Good afternoon. I hope you had a good lunch. And I want to thank InterSystem and I want to congratulate them as well for organizing such a successful event. So it's a very enjoyable first half today. And then I hope that we continue to learn from each other until even the networking night, right? So what I'm going to do today is I'm going to share two studies that we do. One is a study that's still ongoing. I'm just going to share some preliminary findings that we have. And then we have another study that we just published that is going to be useful for you. So post that, I'm going to talk a bit more on some of our engagement across the healthcare ecosystem, as well as leveraging on the HIMSS framework. And then I'm going to end with 3 case studies. Okay? So I'm going to start first with talking more about HIMSS, in case some of you here do not really know about our company. So HIMSS, we have about 60 years of history. We started in 1960s, and then now our headquarters is in the Netherlands. It's a small company, about 300 people across the world. The Asia Pacific headquarters is in Singapore, and that's where I'm based in. And although we are small, we are very impactful because globally we are known as advisor and thought leader with our engagement in various countries at the government level and even with the provider level. And our vision is to realize the full health potential of every human everywhere. And the mission is to reform the global health ecosystem through the power of information and technology. There are 4 main areas that we make an impact. The first is our advisory service. This is where we engage the healthcare providers or even the government on their digital transformation journey using the HIMSS frameworks, namely the maturity models. And we also conduct events, especially once a year in the US. We have one of the largest healthcare IT conference in the world. This year we had it in Vegas. We're going to have it in Vegas again early next year. And we just had our APAC conference in Malaysia, and then the next one that we're going to have it next year, we have not announced yet, so stay tuned for our announcement. The other part that people do not really know more about us is our research portfolio. So we do a lot of research specifically based on the data that we collect from the maturity models, as well as the work that we do in the entire ecosystem. And then we also have, we publish white paper, policy positioning paper, so we publish various kind of things. And there's another very, very important area, which is the professional development. Because I think we hear a lot in various conferences that there's a lack of people who know, right, how to do the digital transformation, or even the clinicians themselves need to be enabled for that. So that's the professional development part of it. So I'm going to go into the first studies that we did. So like I said earlier, this is still in the initial phase. We are targeting to get about 200 respondents. So now we have about 100 plus. So that's ongoing. And this study will conclude once we reach about 200 respondents. So in this study, we try to examine the experience of AI users in the healthcare facilities across Asia Pacific. And then what we are trying to do is to understand the challenges and pain points for AI implementation so that we can help to suggest how we can do a more effective AI implementation. And in the study, interestingly, we found that the top 2 things that the organization want to address in AI is workflow optimization and medical documentation. So both of these score very high, about 49%. And then you can see that the rest going down this graph. And maybe these are some of the things that it might resonate with you, because these are the APAC respondents that we get, and then that can be for your reference. And then quality of patient care was cited as just 24% among all the respondents. And if you look at barriers to AI adoption in Asia Pacific, you'll see that the top that will come, the one that scored the highest is about cost. And then there'll be others like the data security and all those. So those are the challenges that we find in this initial study. We do not foresee the top ones to change drastically, but then as we collect more data, then we'll get more insights. So if you're interested to participate in this study, do scan this QR code or do take a picture of this QR code. It's going to just take 15 minutes of your time to complete this study, but it's only limited to people working in a healthcare provider organization. So if you're a vendor or you're working in other areas, even if you submit the study, we're not going to use your feedback. And then, of course, there are perks involved. Like you can see from there, there's a US $50 Amazon voucher or equivalent Grab voucher that we can provide from this study. So the other study that we recently published, so this one is already published. Later, I'm going to share the QR code so that you can actually download this study, is the EMR experience in Asia Pacific reports. So from this study, you can really get a lot of insights, especially, so we did the same, about 200 sample size for healthcare professionals. And the study really sought to understand the experience with the EMR systems and explore the various factors, how it can impact your success. And some of the key findings, as you can see on the presentation, is telemedicine, right, is viewed as the most challenging feature. And then I don't know how does it resonate with you. You might have a very different challenging feature. And then interoperability woes is still predominant across Asia Pacific. And then we can see that usability pain point is very, very critical because there's a lot of feedback on usability of the feature. And then usability of the EMR. And then app integration is among the most challenging feature. So it's also ranked quite highly. I'm going to go into details on some of this. Clinicians perceive an increase in the time they need to waste by using the EMR system. And then there's also the care coordination issue that they find that it's not easy to implement that. And data analytics and AI will require more strategic planning. So the first one that we're going to go into is telemedicine. So you can see in the survey, we try to look at two angles, right? One is we ask IT and the leadership on how is their experience on implementation of this feature. And then we also ask the clinician, how is the experience on utilization of this feature? So you can see that they view this as the most challenging to implement, as 80% of the IT and leadership say is very challenging, and 74% of the clinicians, right, say that it's not easy to utilize. So among some of the factors that you can see, a lack of internet access, especially among the patients that they are trying to engage with. And then the technical complexity, especially when they try to use that. And then very interestingly, the physicians, even if they have a system within a EMR for telemedicine, sometimes they have different preferences. They might want to use Zoom, they might want to use WhatsApp, so there's lack of integration there, and so that created some problem as well. And then the next one is interoperability woes. You can see that as they try to integrate data between the systems, they say that it's not easy to just take this data on its own, and that they need to do some correction for it. And a considerable number of this also says that sending data from their current EMR system to other facilities is not easy. So that is quite predominant across Asia Pacific. And how about usability? You can see that They say that poor usability is always a big big obstacle for the user, and like complex and non-intuitive interface, making navigation difficult, and workflows inefficiency. And there are features such as patient scheduling, the CPOE, as well as risks were noted for their onerous steps. So there's a lot of steps they need to go through before they can utilize it. And then the complaint is also about occasional system outages and the system hang as they try to process large files, especially using their PACS and medical imaging. So the other thing is about app integration. As you try to integrate third-party apps into your system, these are some of the response. So it's known as the second most challenging feature. So 73% of the IT and leadership say that this is very, very challenging to implement. And the third most challenging feature to utilize, interestingly, right? 67% of the clinicians say that. And among the IT and leadership, they say that there were concerns about bugs, about security, as well as risks from the third-party apps. And then if you look at the clinicians, they say that they're confused about the purpose of various apps. Probably you are providing them a lot of apps that they can leverage on, so they're confused about how to do that, as well as they say that there's a continuous upgrade or update of this app, and then they do not know which apps that they should be using. And then care coordination needs improvement. They say that it's the second most challenging feature to utilize. 73% of the clinicians, they feedback on that. And they also say that there's a lack of functionality around coordinating care plans and with the community partners. So sometimes the hospital might be very advanced, but the partners that you work with might not be able to support that. And then the IT and leadership respondents say that the challenges around needing a concerted inter-service effort to implement these tools. And finally, data analytics and AI implementation need more strategic planning, and it's the third most challenging feature to implement, as feedback by the IT and leadership. There's 68% of them that say that. And there's doubts about the reliability and accuracy of data analytics and AI-driven insights. And then the other commonly noted challenges include the large memory and storage requirement, lack of skilled staff to run them, data protection, concerns of these large data sets. These are just brief insights on what we capture in the EMR experience study. So if you want to get the full report, you can actually take a picture of this QR code, and then you can download this EMR report so that you can actually get more insights. I'm going to just leave it for another few more seconds. So you have seen, based on the EMR experience study, there's a lot of challenges that is encountered by the IT, the leadership, as well as the clinician. So for HIMSS, one of what we do is to make sure that we can support the entire ecosystem well. And then in 2021, we actually came out with a digital health technology partner program. So what we try to do is we want to train technology partners so that they can have a full knowledge of the HIMSS maturity models. And with this kind of knowledge, they'll be able to help you in your digital transformation process even better. And one of the digital technology partner and one of the more successful digital health technology partner in the region is, of course, InterSystem. And if you look at some of the benefits of working with this digital health technology partner, you'll include that they have an in-depth understanding of the model, because before they can get certified to be a digital health technology partner, they need to undergo training, and then we do a couple of workshops with them just to make sure that they understand the model. And they do a model their solution to the model mapping, so that they can let you know how you can actually leverage on the model and progress your maturity. And by having all this knowledge, they are able to recommend solutions that will optimize your investment. Because in digital transformation, there's a lot of things that you can invest in, right? There are fanciful things that you can invest in. Of course, now, today, this morning, we talked a lot about AI. You can invest a lot in the AI, Gen AI, Agentic AI. But then, what will be the investment that can be the best for you so that you can eventually get the best outcome that will help you achieve the goals that you're looking for? And so there are a few models from us that the digital health technology partner can be trained on. So today, specifically, I'm just going to talk about MRAM model. But then besides MRAM, which is more for EMR maturity, we also have infrastructure maturity model. We have analytics maturity model that will be really looking into data, advanced data, machine learning, data governance, so that it can get you ready for the adoption of AI. And then we also have continuity of care model, where it's more for care coordination. We also have the non-hospital model called CCOM. And then we also have, finally, I think one more, that is digital health indicator. So digital health indicator is a model that looks holistically across your entire ecosystem, and it can help you in your capacity building. It can help you in doing your strategic planning. But then today we are just going to focus more on MRAM. So you can see from the model, and also I think Luciano talked earlier this morning that the MRAM model is an 8-stage model from 0 to 7. And then it actually allows you to have a roadmap. So they can, you don't have to be at the highest maturity at the beginning, right? But it can let you see a progression on step by step, how you can actually reach a higher level of maturity. And then, based on our research, we have seen that if you reach at least stage 3 and above, you can start to realize certain form of return on investment. So that's one of the minimum stage that you should be aiming for. And for us, based on our work with a lot of governments and a lot of providers in the region and across the world, you don't need to be a stage 6 or 7, unless that's your aspiration, right? So you can be a stage 3, you can be a stage 4, and then that might already help you to achieve your hospital objective. And by using this model, you can actually reduce the risk. And like I said earlier, it provides a clear roadmap, and it enables you to benchmark. Because sometimes when we invest into digital transformation, we get questions by the management, well, you're spending all this money, what's the improvement that we can see? So by having a way to benchmark, you can actually see how you have improved. And then, of course, the benefits will be improved safety, outcomes, and efficiency. And this is a study to show the maturity of the various regions. So you can see that North America, of course, consists across all the hospitals that we have done an assessment on, they are the most mature, scoring 5.6. And then this is followed by Asia Pacific. So later I will just provide more insights on why Asia Pacific has scored a higher score for MRAM. And then global is 3.8, and then EMEA is scoring lower. But that's also based on the different projects that we're doing. So if you look at EMEA itself, there's a lot of government projects that we're doing at the national level. So when we do the projects at the national level, these hospitals are not going for the stage 6 and 7. They're actually trying to benchmark each of these hospitals and incentivize the hospital as they progress in their maturity. So you see that they have a lower score, but not necessarily that they are not good. It's because it's more broadly used, right? And then in Asia Pacific, a lot of hospitals that engage with HIMSS is mainly because they say that, I want to achieve a 6 and 7. That was in the past. And you can see that this data was from 2020 to 2023. And then if I present a newer data, probably next year, if I have those data, then you'll see that you'll be a bit different as well, right? So if you look at the maturity across different countries, of course it's not comprehensive. US score the highest, and Taiwan is tied to US. And that is also because the customers in Taiwan that leverage on this model, they are aiming to get recognized for their stage 6 and 7. That's why you see a very, very high score there. And then that's followed by Saudi, as well as South Korea. And then the rest of the other countries, you see the scoring there. And sometimes we get asked the question, right, why should we be leveraging on MRAM, right? Okay, you are showing us some of the benefits like the roadmap, like better outcomes. So we have an Office of Scientific Research based in North America, and throughout the many years we have collected a lot of data, and they have shown that if you achieve a higher level of maturity, you can provide safer care. Right, there will be lower infection rates and reduce adverse events. You can provide better experiences for your patients. There will be smoother transition and improved communication. Better efficiency, shorter length of stay for chronic illness, especially on COPD and heart failures, and productivity, right? Improve and better productivity. So you can actually free up the beds or free up the facilities so that it can be given for patients who actually need them. So I'm going to run through 3 case studies to end my presentation. So the first one is Pondok Indah Hospital Group. I know they are not in the room, they could be in the other session, but I want to congratulate them again because recently they are the newly minted HIMSS MRAM Stage 7 site. And they are the first in Indonesia to do that, right? So we should give them another round of applause. And prior to that, they were the first in Indonesia to achieve Stage 6 in 2022. So you can see in this case study that some of the challenges includes change management, right? The staff adoption of the system. So that usually ranks very highly because when you talk about digital transformation, it's not just the systems or the processes that's in place. The people is so important. And then in these 3 case studies, you can identify some of the similarities. And then, of course, fragmented infrastructure and some regulation from the government that give them some pressure. And COVID-19 actually drives some demand, right? Especially there's a need for telemedicine and secure data. And then the interoperability, especially with the Satu Sihat. And the outcomes in terms of efficiency and safety, fewer errors, right? Fewer medical errors and faster care. And then when it comes to patient satisfaction, that increased as well. And then also safer medication for them, and operation efficiency, it was boosted, and as well as they get global recognition. And then I think because they were the first site in Indonesia that received a Stage 6, then post being recognized by HIMSS, they get a lot of requests to visit them. And then, of course, Pondok Indah have to kindly reject some of this because they still need to do business as usual, right? And then some of the key lessons that we learned includes the benchmarking is a very, very strong motivator for them to push the organization in terms of embracing technology. And there's a need for government support, and there's also a need for continuous training. Because every time there's going to be new people that comes in, and then you need to have the key advocates that tell them, why is it so that they need to be leveraging on the systems. And then interoperability will remain critical for them. And then, of course, next steps will be more advanced CDSS and digital-ready facilities. So that's Pondok Indah. So for case number 2, I want to congratulate IJN for their Stage 6 achievement. And Prof. Alwi is here, so I want to congratulate them again, being the first Stage 6 hospital in Malaysia. And then some of the key challenges that you can see from here as well is still change management. So when because I spoke a lot to Prof. Alwi, so he said that they have to use a top-down approach. Of course, there are many things that they did, which I think he's going to share in a later session. But that's a big thing, right? In order for your system to be fully utilized and for you to be able to get good data and moving forward, you really need to do the change management for them to adopt the system. And then there's also the rapid shift to near full automation in 1 year. So they give themselves a very short runway. They said, okay, we are here now. We want to achieve stage 6 validation within this time frame. So it's a huge, across the organization effort to make that happen. And besides going for the MRAM, of course, there are many other priorities, as well as the daily operation. There's a high patient demand and IT upgrades and staff training. So some of the outcomes that you can see from here, that in terms of clinical outcomes will be fewer treatment errors, right, and stronger workflows, and patients are happier, the safer medication as well as transition, efficiency improve. 320,000 annual visits is a lot, and 4,500 surgeries is a huge amount, right, of surgeries done a year. And because of their achievement, now they play a leadership role in Malaysia because everybody is looking to them, and then they get a lot of visits, not just in Malaysia, but also from different countries to try to see how they implement. And then I know IJN is one of those hospital that always share everything that they have done. Always so willing to share. You can talk to Prof. Awi about it. And then how about the lessons learned? The MRAM as well as the roadmap is a good motivator because you know that with all the effort put into digital transformation, there's a stage and there's a recognition that you can be recognized for. And change management and phase out your IT investment is a key thing as they're shared. And then the aim is to go for stage 7. And then we know the timeline, and I'll let them announce it themselves. But that's the next step that they're going for. And then strengthen interoperability as well as hospital innovation is also another thing that they're looking for. And the last case study is also Indonesian hospital. That's EMC. And I don't know if you are here, but then let's give another round of applause for EMC because their one is new, right? They received their stage 6 recognition this year. And EMC, I think they are very strong in many areas, but some of the challenges that they had were like data security, interoperability, as well as having to comply to all the different regulations. And then standardization, especially across multiple hospitals, because I think 8 sites, right, if I'm not wrong. And then staff adoption of it. So you can see consistently across these 3 case studies that change management, staff adoption of the systems that you put in place is a consistent challenge. And then one of the things that the framework for MRAM do very well is it provides you with a structure how you can actually do your change management. So I've seen many cases in other countries as well where they put in a very good system, but there's very, very low adoption. And then they can't get the outcome that they are looking for. And then also very short runway for them. So it's 13 months from start to getting validated. And they make use of the gaps, the reports that we provide to them in the assessment so they can see what they need to prioritize in order to do that. And also the national challenge, especially with digital maturity across different providers. What about the outcomes? So patient experience, it gets better. Shorter waiting time, safer meds, empower access via their apps that they produce. And better clinical and operational efficiency and broader impact because they are able to integrate with Satu Sehat. And lessons learned, they see that the roadmap is useful for them in terms of investment and training. And the key lessons is early user engagement. especially when you are putting in a new system, you need to engage the users early so that they are journeying with you in the digital transformation. And they are planning for stage 7 as well, and then, of course, the other technological advances. Going to my last slide. This is not comprehensive, but it gives you a snapshot of the work that we have done across Asia Pacific in a very, very short time, because prior to 2020, we don't have a local team that can support across Asia Pacific. But now we have many people based, we don't have many people, we have a small team, but we have people based in different countries that understand your needs, and then we can support you locally. So we hope that you can join the organizations who have benefited from working with us, and then we look forward to journeying with you. So if you would like to talk further, because especially on some of the models which I only touched briefly on, or on how HIMSS will be able to collaborate with you together with InterSystem, you can write email to contact me. I'm Dalvin Low, and thank you for your time.